All right, here we go. So, here we have my wonderful subject here. Just going to get their ankle taped. So, some of the purposes for taping ankles would be to provide support post-injury. Maybe she had some sort of an ankle sprain or something and just needed some extra stability during her game or practices or whatever. Another purpose would be to maybe she just has generally weak ankles. Yeah, probably does. However, taping isn't going to just solve that, so we probably want to hop them onto a rehab program and strengthen their ankles up. Taping is kind of just a Band-Aid on that issue. And then also to prevent inversion, which is the most common type of ankle sprain. Although we can tape it away if they had an eversion ankle sprain, we can tape it up to try and prevent that. There's also, some injury prevention type things just because of the added support. So here we have a clean ankle, dry, no wounds, no jewelry, just a tattoo. Going into 90 degrees of dorsiflexion, not going to be lazy, going to keep that where it needs to be. So I'm going to spray my adhesive here, put on my heel and lace pads to prevent friction. Then I'm going to throw just a little bit of pre-wrap around here. So that way, no tape has to touch the skin. We're just going to do a thin layer, nothing too thick, all the way around here. Down, around, and around the foot. Back down this way. Okay. And then we're going to start off with 3 circular strips right at the top here. Usually you would put it half skin, half pre-wrap. I'm going to go ahead and not do that because I don't have any cutting tools at my house. So it's going to make it easy to remove. So we're going to rip that. There's one. And these you'll want to overlap half and half to get some coverage. 2. And one more. Coming around. Making sure to tear the strips. You don't want to go continuously, otherwise it'll get too tight. And then we're going to do one more right down here at the bottom of the foot. Proximal to the base of the 5th metatarsal, which will be right about where the lateral side of the foot kind of juts out. So we'll come up here, coming around, top, rip that, and try and get it as smooth as possible. It's a little hard because it's a weird angle to turn the tape around. So then, after our circular strips are there, we're going to do our first stirrup going medially to laterally to help prevent some inversion here. So we're going to throw these on our anchor strips. Oops. Right here. Pulling the foot into slight eversion. And then anchoring on to the lateral side. Then we're going to do alternating stirrups and horseshoes. You're going to try and get those horseshoes as low as possible. Wrap that around. Stick it to the other side. Another stirrup. Again, pulling into slight eversion. Another horseshoe here. and one more stirrup and one more horseshoe. Don't count me off for that. Okay. Up. Lock down. One more horseshoe. Right in here. Okay. And after that, we'll move on to our heel locks. So we'll do one medial and one lateral, and we'll do those twice. So right at the top of the foot here, we're going to go down and around the heel and back up. You can tear here, or you can go one more to the medial side. I'm going to tear it. And then we can go down and around the heel this way and back up. And you want to look to make those triangles right there in the ankle. So we'll do one more set of those. Here we have a medial heel lock, down and around and back up. And lateral, down and around and back up. Right there. All right. So then after those heel locks, we're going to go ahead and do our closer strips. Just sealing up all those spots that we can still see some pre-wrap, all those windows. And we're going distal to proximal, so that way we don't get any swelling or fluid pooling down in the foot. We want to push that back out. One more here. Down and around. Okay, and I'll do a couple more just to lock these anchors down since they're up higher. Okay. Right there. And we are going to do one more strip right down here. Again, avoiding the base of that fifth metatarsal. One more circular strip. And that is a taped ankle. So for now, we go ahead and let them stand up, check it out, see how it feels. Good?
Yep.
Cool. Okay, so now that we have this all taped up and nice, they just got done with their game, they just got done with their practice. So we'll go ahead and remove this. I don't have anything to remove it. That would be safe. But you can either use a shark or some of the safety shears that have a little metal piece on the end so they don't go stabbing themselves in the leg. That would be a whole nother problem that tape won't solve. But if you have the shark or the safety shears, you're going to want to cut away from the athlete, kind of coming down the side and looping around this the ball of their ankle there.